Are you over 60 and looking for a safe and effective way to boost your strength and mobility? You're in the right place. Many of us think a daily walk is all we need to stay active. And while walking is fantastic, it might not be enough, especially as we get older. Joint pain, balance worries, or just feeling tired can make it hard to get the full benefits. In fact, many surgeons and physical therapists are now recommending a different approach, something you can do right from the comfort of your home. It's gentle, safe, and incredibly effective. Before we dive in, a quick reminder: this video is for educational purposes. Please always talk with your doctor or physical therapist before starting any new exercise program to make sure it's right for you. So, why isn't walking always the complete answer after 60? As we age, we naturally lose muscle mass and bone density. Walking is great for our heart and endurance, but it doesn't always target the specific muscles we need for stability and strength, like our quads, glutes, and core. These are the muscles that help us stand up from a chair, climb stairs, and catch ourselves if we stumble. If we're dealing with arthritis in our knees or hips, long walks can sometimes make the discomfort worse, not better. That's where targeted low-impact exercises come in. They allow us to strengthen these crucial muscles without putting extra strain on our joints. This brings us to the wonderful world of chair exercises. They're a game changer for so many seniors. First, safety is a huge plus. Having the chair for support dramatically reduces the risk of falling, which gives you the confidence to push yourself a little more. Second, they are incredibly accessible. You don't need a gym membership or fancy equipment. All you need is a sturdy chair. This means you can do them anytime, anywhere, whether you're watching TV or waiting for the kettle to boil. Chair exercises are also perfect for improving circulation, especially in the legs, which can help reduce swelling and stiffness. They isolate specific muscle groups, helping you build functional strength for everyday activities, like carrying groceries or playing with your grandkids. Alright, let's get to the main event. I'm going to demonstrate a simple yet powerful chair exercise that surgeons often recommend. It's called the chair-supported leg extension. Find a sturdy chair without wheels. Something like a dining room chair is perfect. Sit toward the front edge of the seat, with your back straight and not leaning against the chair back. Your feet should be flat on the floor, about hip-width apart, and your knees bent at a 90-degree angle. Place your hands on the sides of the chair for support. Now, take a deep breath in. As you exhale, slowly and with control, straighten your right leg out in front of you. Squeeze the big muscle on the top of your thigh or quadriceps as you extend. Try to get your leg as straight as you can without locking your knee. Hold it there for about 3 seconds. Feel that muscle working. That's what we want. Now, slowly lower your foot back down to the starting position. That's 1 repetition. Now we'll do the same with the left leg. Breathe out, extend the left leg, squeeze the thigh muscle, hold for 3 seconds, and then slowly lower it back down. The key here is control. We're not kicking or swinging the leg. The entire movement should be slow and deliberate. Aim to do about 10 to 15 repetitions on each leg. Once you've completed a set on both legs, you can rest for a minute, and then do another 1 or 2 sets if you feel up to it. Remember, it's about quality, not quantity. Let's talk about a few common mistakes to avoid. The first is using momentum. Don't just swing your leg up and let it drop. The magic happens in the slow, controlled movement, both on the way up and on the way down. The second mistake is slouching. Keep your core engaged and your back straight throughout the exercise. Imagine a string pulling the top of your head toward the ceiling. This good posture protects your back and helps you engage the right muscles. Another common error is holding your breath. Remember to breathe steadily. Exhale as you lift your leg and inhale as you lower it. Proper breathing helps deliver oxygen to your muscles and keeps you from straining. Finally, don't overextend or lock your knee at the top of the movement. Keep a very slight, soft bend in the knee to protect the joint. So, how often should you do this exercise? For most healthy seniors, aiming for 2 to 3 times a week on non-consecutive days is a great goal. This gives your muscles time to rest and recover, which is when they actually get stronger. You can easily incorporate this into your daily routine. Maybe do a set before breakfast or during a commercial break. Consistency is far more important than intensity. A little bit done regularly will give you much better results than one long, exhausting session once a week. Listen to your body. If you're feeling sore, that's normal at first. But if you feel sharp pain, stop and rest. Now, it's important to know who should be cautious with this movement. If you've recently had knee or hip surgery, or if you have a serious injury, you must get clearance from your surgeon or physical therapist before trying this. They might give you specific modifications. For example, if extending the leg fully causes pain, you can simply lift your foot just a few inches off the floor. The goal is to engage the thigh muscle without causing discomfort. If you have severe back pain, make sure sitting upright doesn't aggravate it. You could try placing a small pillow behind your lower back for support. The golden rule is, if it hurts, don't do it. There's always a way to modify or an alternative exercise that will work better for you. To wrap up, let's go over a few extra tips for staying active safely. First, always warm up. Before you start your chair exercises, march in place for a few minutes or do some gentle arm circles to get your blood flowing. Second, stay hydrated. Drink water before, during, and after your exercise session. Third, wear comfortable clothing and supportive shoes, even when exercising at home. Good footwear helps with stability. And finally, consider adding other types of movement to your routine. Gentle stretching can improve flexibility and balance exercises, like standing on one foot while holding onto a counter, can further boost your confidence. This simple chair exercise is a fantastic tool to help you build leg strength, improve your balance, and move through your day with more confidence and less stiffness. It proves that you don't need to do intense high-impact workouts to make a real difference in your health. Thank you so much for joining me today. I hope you found this helpful. Give it a try, be consistent, and listen to your body. If you enjoyed this video, please give it a thumbs up and subscribe for more tips on staying healthy and active at any age. We'll see you in the next video.